University of Leeds for this case. This was an 8-month-old, the dome of bladder resection. At first, I thought of urachal adenocarcinoma because when I think of dome of bladder, that's what I think of. That urachus, which is the connection from the umbilicus or the belly button to the dome of the bladder. But after this case and reading up on urachal adenocarcinoma, that's more seen in older adults around like 50 to 60 years of age, and it wouldn't have this appearance that we see here. So when I first looked at this case, besides that thought, I noticed how these cells reminded me of small, round, blue cell kind of tumors, which should immediately raise your differential of Ewing's, neuroblastoma, desmoplastic small round cell tumor, Wilms tumor, some lymphoma as well. And so I wasn't really sure what to make of these. On high power, there's abundant mitotic figures, and the cells have high NC ratio. They kind of have a stippled pattern chromatin and some indistinct nucleoli, some rare nuclear grooves as well, with admixed lymphocytes in the background, some clearing as well, against the background of kind of smooth muscle in the bladder wall. I think what drew my attention that this could be neuroblastoma, or what did draw my attention, is this area here. I saw what I thought was initially on low power edema, but if you look closer, it's characteristic neuropil, and that was the clincher for me that, oh, this is neuroblastoma, because it's small round blue cells with neuropil. And remember, neuroblastomas can grow anywhere along the sympathetic nervous system. If it's the right age, you mainly see neuroblastoma. The average peak incidence is around 2 years of age. And then after looking at that section, going back to this section, you can see suggestions of Homer Wright rosettes, these small round blue cells with, in the center is neuropil. So if this were my case, I would put the differential of neuroblastoma along with the small round blue cell tumors and send it to a pediatric specialist to get to further assess for MYC amplification, which have prognostic implications. If there is MYC amplification that has unfavorable prognosis, more than 10 copies. And then I think the other important thing as a general pathologist is what immunostains you can do to differentiate. So you can do, I get a synaptophysin and chromogranin, neuron-specific enolase, which would be positive for neuroblastoma. You can get a CD99, and it should be diffuse membranous if it were Ewing's sarcoma. You can do a WT1 for Wilms tumor. You could do a MyoD1 to assess for a rhabdomyosarcoma, CD45 for any lymphoma, and you can do cytokeratin also, and as well as a WT1 for desmoplastic small round cell tumor. So, very interesting case of an 8-month-old with neuroblastoma in the dome of the bladder. Key is the neuropil right here, and just think of your small round blue cell differential.